Good evening. Welcome to our January 14th, 2025 Commission on Disabilities monthly meeting. If we could start off with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. If Pauline, if you'd be able to take the attendance. I'm not sure if you stepped away for a minute. So I will start the attendance. Jason Barone,
Present.
Myra Gamas,
Present.
Ellie Vargas,
Present.
Anne Marie Fiore,
Present.
and Pauline Perno. Yeah, she was here, so she stepped away, so I'll move her to back and then I'll sign her. Let's see. Item number one is a motion to approve the meeting minutes from the December 10th, 2024 meeting. Friday, I sent everyone out along with tonight's agenda, the meeting notes from the December meeting. First, I just want to ask if anyone had seen anything that was incorrect or anything that was missing. Please let me know so that I could make those changes. If not, if I could have a motion to accept.
Motion to approve. I second it.
Okay. Item number three. Actually, item number two, there was no guest speaker, so we will skip right on it. Pauline is present, so I will mark her as present.
Thank you.
Okay. Item number two, I was saying there's no guest speaker, so we'll just skip right over that. Item number three, updates and next steps from our December 10th meeting. The first thing for an update is updates from Pauline and Marie regarding the calendar for future monthly guest speakers, just as we have this as a normal update from month to month, just to see if we've made any headway on trying to find anyone for that.
I've gone back in and retapped into folks that have joined us in the past to see if anyone's willing to come in and give any updates as far as new information, things such as that. I have not received any information back from anybody, so I've got 5 waiting.
So yeah, just if anybody just let me know. As of right now, we don't have anybody for the February meeting. But if you do, if anyone say anything with you and Marie, just schedule them, either yourself or Pauline, just schedule them and just let me know. You don't have to go back to me because I don't have anybody. Just get their information and then we'll put that on the agenda for any future meeting. The next item we have is the draft letter from Pauline that we tabled from the December meeting. Since Pauline was unable to make the meeting, we decided to table it. I believe everybody you should have that letter. So we just wanted to see if everyone's able to take a look at it. If anyone has any ideas or any changes or any additions to that letter, I'm just going to open it up to the maker of the letter first with anything that she wants to comment on it, and then we'll just go around to each commission member to see if they want any suggestions on whatever for this letter.
No, I'll take any suggestions you have. It's kind of hard when you draft a letter and you know what you want to say, but you don't want to come off as being abrasive. So if anyone has any input at all, please do give.
Any members get a chance to take a look at it or any suggestions on any additions or subtractions from this letter? Like I said, I wanted to send it um, Representative Turco, who represents the area down the boulevard. And, you know, I didn't know if we want to include, having further discussions, if the letter should go as is. And I don't know if there's anything else that, um, on possibly setting up a meeting. I'm not sure how we want to end this letter, or if we just send this letter as is, or.
I think my thought is sending it as is with kind of an open-ended that any suggestions or anything that Jeff has to bring back to us, that we're willing, whichever way.
So as of right now, how we have it addressed at the end of it, did you want to add something else to that, Pauline, and just send it to me, or?
Yeah, let me take a look after. I'm sorry, we're all broken out. And I'm not being very good about this. Let me take a look at it after the meeting and see if I'll consult with my folks downstairs, because now I have 4 of them. So it's getting better. And I'll get that. And then if anyone, if I send anything to you, if you want to post it, if anyone wants to meet with me, like one-on-one, one-on-two, whatever, maybe shore things up, that would be, well, I'm that.
Okay. The only thing we can't do is because of open meeting laws, we can't do that.
Oh, all right. No, I'm just going to say just to, and then then bring it back.
Yeah. Yeah, so we have to, you know, if anybody has any input, anything they want suggested to it, they could send it to you, and then we can bring it to the next.
Okay. Yeah, that would work.
Finalize it that way.
Okay, great.
Because we just have to follow the rules of open meeting law, to do it that way. So, so if that sounds, if there's that sounds okay, any other members want to add anything to that or comment on it?
I think it looks great as is, Pauline, but I think that's a really good idea to maybe add some language at the end, just letting Representative Turco know if there's any feedback that maybe he has that maybe would make it a little bit of a stronger case on our end. I think that's a great idea to maybe get his input, since he's going to be the one, you know, on our behalf.
Right.
But other than that, I think it's a great motion and much needed.
Yeah.
I'm gonna be the damn entropy.
Basically, we want to, we really need some help in trying to bring this to the attention of the proper entity, which is possibly, which more than likely would be the DCR, since they control the boulevard. And, you know, we don't have the power. We can ask, but as Representative Turco, he would be the best person to help us with that and lead the way on that.
I think the more help and more support we can get on our side, the Revere side, that going and bringing it to DCR would be more a stronger suit for us. So, you know, I for it.
Okay.
All righty.
Okay, perfect.
And do the wrong thing.
Thank you. Thanks.
Are you having an issue with anything? Okay. So the next item, under the next thing in item 3 is Anne Marie's formal plan for the music therapy program, which possibly is going to include 3 preliminary workshops. COD is wanting to present a letter with information and partnerships with the Revere Parks and Rec Center. That COD is going to fund. Anne Marie, if you just want to let the whole committee update on, you know, yeah, I believe you're looking to have another meeting with.
Wonder if you can call if I see if they have it down, you can just get it and the cake too.
So that we can send a letter to the Recreation Center, formal letter.
Yes, so I have a plan drafted. I'm just waiting to speak with the senior director from the community center. He's going to give me a little bit more information on scheduling and funding, which I know funding won't really apply or be necessary to present to the rec center, but I think the scheduling aspect of it will be a little bit more crucial to try to nail down to coordinate with the rec center, so they have a better idea of what we're looking for as far as scheduling goes. So I'm just waiting to meet with the senior director. I'm waiting to find out a time that he can meet on Zoom, and then once I have those last.
Is that at the music therapy group?
Yes.
Okay.
Yep. So he's the senior director, and he's going to give me more information on the scheduling aspect, also the funding aspect, which will be important for us. And then once I have those final pieces, I should have the plan complete to submit.
And we still looking to have the 3 workshops as a Zoom?
As Zoom,
Are we looking, what were we looking to do for the workshop? In person?
or maybe potentially hybrid.
Yeah, exactly. That's right. That's right.
Mhm.
Remind me. It would be hybrid, so there will be in person with the hybrid component. That we would also talk to Revere TV about helping us with that aspect.
Yes. Yep. So hopefully, if we can have that plan to the rec center this month, maybe we can start looking ahead to, like, I don't know, the spring, if we think that's appropriate.
Thank you. So even though this winter hasn't been bad anyway, not only for time, you want more time. We don't want to rush the program, but we also don't want to put something in and then there's bad weather anyway. Because you never know, knowing what could happen. This weather could change a dime. Even though we've been lucky so far this year. So yeah, so that's a good plan. So yeah, as soon as that's done, if you want to send me some information, you can do the letter. If it's done before our next meeting, this way we can get that to the rec center and I could possibly have information back for our next COD monthly meeting on the process, how that's going.
Sounds great. That will be the plan on my end.
Okay. So basically, item number 4 is basically the same as what we as that last part for the formal plan for music therapy. There's just discussion regarding the community music center. Brought some proposal. As a commission, we always seek programs we can implement to Revere to benefit children and young adults with disabilities. So we're still waiting, as you said, waiting to talk to the senior director from there for more information. So item number 4 basically will basically still be like as a table item that we'll keep on the agenda because we're still waiting for that. Once we have all that, then we could approach the recreation center regarding that. How we want to basically partner with them, but financially we are going to support this program, but logistically we would want to partner with them because of facility wise. Is why we rec center that if they wanted to with the programs that they offer to the rec center, but we would not financially support it.
Great.
Any other members want to any suggestions or any comments on that?
No, I think the timing is good. As you said, because you don't want to put something in place quickly and then have to be canceled and then rescheduled, because once we have to start doing things like that potentially lose folks and whatever else. And maybe by that time, all of the, the high illness rate and the norovirus over and done with, people can commit to it and actually attend. So I think
Perfect. Okay. As any other members want to make any comments? Let me see. Item number 5 is Coda Commission on Disabilities Alliance monthly meeting was held on Wednesday, January 8th. And a couple of items that were discussed there. A COD member from Acton had questions regarding emergency preparedness plans for communities, especially developments with residents with disabilities. And one thing with that is The Mass Office on Disabilities used to host emergency preparedness on-site trainings and give to-go bags as part of the planning to municipalities such as senior centers and other organizations within a municipality through a grant that was given to MOD by NEMA. But that had stopped as of last year. They no longer funded that program. So as of right now, MOD does not have that program. So basically you want to reach out to NEMA or go to their website. They have a lot of information on there as the pamphlets that were given out. They don't do any on-site training or give any emergency to-go bags. The other resource that communities can reach out to is to whoever their emergency preparedness director is, to find out if they have any plans or any other information that they could give to senior center developments or other organizations within a community to help them. But the best resource right now is the MEMA website. They have a lot of pamphlets and information on there on how to create an evacuation, like self-evacuation plan for your household or for your center, such as a senior apartment building or things like that. So that's that was what was that topic was discussed. Also, the Newburyport COD spoke about brick sidewalks and how that town is against removing them, even though they cause difficulties for people with disabilities. They have the older style of brick and not the wire cut type. Where the wire cut type is it's not the best source of a walking path, but it is not as abrasive and rough as the older style bricks. They're still not the best for people with disabilities, mobility issues, people in wheelchairs. So because they also need to be maintained. A member from the town of Newton mentioned that they have instituted and replaced brick sidewalks with something called stamped concrete that looks like brick. It's a better version than the old style of stamped concrete, and it can be colored to look like any style needed. And it's a great alternative for communities that want to keep that older brick look for historic characteristics. Unfortunately, a lot of communities think that brick has some type of historical significance or value. But unfortunately, they really need to take into consideration people with disabilities on how that really affects their mobility issue, walking, and just getting up and down the streets. So that's a big issue, and it's a big hurdle with a lot of communities. I'm glad to see that Newton has been doing a great initiative on using that concrete, that stamped concrete look. There used to be a problem with the way it looked years ago, but now it looks just like brick. It's really easy to maintain. And if you were looking at it side by side, you really couldn't tell that it wasn't brick. So it's a great alternative. The next item that was discussed at that meeting is CODs discussed ride share bike programs. The Newburyport COD mentioned that they have adopted a new program that includes one adaptable bike. They have an RFP out right now, and the city of Boston member mentioned that they are part of the Blue Bikes rideshare program, and they also purchased an adaptive bike. But the only issue they have with it is that it is not in use because of its size and docking needs, which you know that an adaptable bike needs a lot more space to dock it, and that seems to be the issue that they're having with it. So they're trying to come up with ways and where it can be docked, because usually with the ride share bikes, you don't have to return it back to where you where you got it. So a lot of people will take it from point A and want to leave it at point B. But because of the adaptable bikes, the docking areas need to be a lot wider, longer, and that tends to be an issue where the normal docking stations are, that there's not space allowance for those. So they're trying to come up with a solution on that, or if people do want to use these adaptive bikes, they maybe have to be that when we use it, it has to come back to point A. So they're trying to figure out resolutions for that. One other city, the Acton COD mentioned, they have a bike share program as part of their town's recreation center for people to rent. So they do have it, and they believe they do have adaptable bikes, but they have to be rented and they come back to their recreation center. So it's not like the blue bikes that have a docking station or something like that. Lastly, let me make sure this is the last item that was mentioned at COD before I say lastly. Yeah, okay, so lastly, the Newburyport COD mentioned the program that they're looking at. It's called Right Here, which is right, it's spelled RIGHT hyphen HEAR. And it can be, you can look up information for it at www.right hyphen here HEAR.com. And Right Here is a program that provides talking signage so everyone can interpret and understand their surroundings in real time. This application and program incorporates the use of a mobile device and install beacons. The environment comes to life through audio descriptions delivered directly to a smartphone or tablet, helping everyone everywhere explore navigation and experience the world safely and independently. They want to see if this could be used and implemented on trails and parkland in the community. I really thought this is something that's very innovative and creative. I actually went on the website and took a look at it. So if anybody has some time, I would take a look at it, at this technology. It looks very interesting, especially for people that are visually impaired. So when you're going through walking trails and things of that nature, I believe it's probably similar to, there may be some museums that use similar technology. I'm not sure. I'm not sure if Jason or Mario might know of some type of things that may use similar technology. But I think this is beneficial for people that want to go look at certain types of attractions or trailways. And it explains it. It picks it up. It's almost like a Bluetooth when you're right there. You have the app on and it will tell you exactly what you're at and describe the whole thing and give you a whole background of it.
That would be very helpful if that does exist. Yeah.
So it's almost like a knowledge base, not a wayfinding, but it's a knowledge base. So, when you're going to see some attractions and things like that. So Newburyport, they're looking at it now, and if they do implement it or they keep us updated, I will keep everybody in the commission updated. But please feel free to take a look at that website. It was in the agenda, but to take a look at it. It's pretty interesting.
Yeah, it does. Sounds interesting.
Yeah.
There is one other thing too. When you were talking about the sidewalks, and I was thinking about it, I looked it up, and Kansas City actually has sidewalks that it doesn't require them to use the same chemicals for ice melt, so it doesn't ruin the sidewalks, but it melts the stuff right on contact. It's some sort of special sidewalk that they're putting in, I've noticed, and that was in Kansas City, Missouri. I was looking at.
Oh, okay.
Yeah, so it would make a huge difference for people, so they don't slip and fall and everything else.
Yeah. Well, that's the other problem with the brick. When the brick sidewalks, they're very hard to maintain in the wintertime, snow removal, ice removal.
But what we're doing isn't working now. That's what I'm saying. They should start looking at other cities,
Yeah.
and that might cut down on the amount of needing to fix the sidewalks as often.
Yeah.
Because the newer sidewalk types that they created, that makes a huge difference.
Right.
But just something that they might want to look at.
I actually, let me see. I actually have some, next item is, item number 7 is commission members' late items. I'll open it up to any members first if they have any late items that they wanted to discuss.
I have a question.
Mhm.
And this is just recent that I've noticed this. Anyone having been down to one marketplace and the setup where one end you have the Planet Fitness followed by Marshall Post Office, etc. Am I just missing it, or am I not seeing the like the accessible ramp to get onto that walk?
We do have
And
them, it's to be so many feet apart. Yeah, they have to have them, they do, they have one, there's, I believe, because when I had to check this out many years ago. I believe there's 3 or 4 of them from one end. to
Yeah,
the-
there's about 4 of them.
Yeah, there's at least 3 or 4 of them.
There's one in front of Planet Fitness. There's one in front of Marshall. There's one in between the
Office,
pastry shop.
Yeah.
Or Big Lots, and then the restaurant.
but I only because I've been to Marshall's a couple times, I've seen that, and I'm wondering if I'm just like completely and totally missing it. That's what I was wondering. Is there a, do you know how far apart they have to be, or is
There-
that specified based on like where you are?
There is a criteria, but I don't know it off the top of my head, but they are in compliance there. And they just have to have it, every so many feet or, entrances, they have to have them, they can't be far apart. But they do meet the requirements that they.
Okay. Yeah, I guess I'm just missing it. I only because I've been to, well, I haven't been to Planet Fitness, but I've been in Marshall's and Post Office of recent. And I remember seeing one over by Big Lots. And of course the big box trucks have been parking right there because they're going out of business and they're offloading things, or onloading, I should say. Okay. Well, thank you. That was my question.
This would be at every store entrance in those outdoor mall plazas, but they have to be centrally located.
Mm-hmm. Okay. Thank you.
Anyone else?
Yeah, a couple things. So one, actually, the first thing I would say to everybody, please be careful. Sicknesses around. We had COVID through where I live like crazy, plus norovirus, plus RSV, plus you name it. It's everything. So please, everyone, wash your hands, wear a mask, be careful. We got enough going on right now. But the other piece, the couple of big things was that I've noticed and found out. And I tell those with disabilities to fight hard, because a lot of employers right now are trying to deny ADA accommodations. So don't just take their first answer of undue hardship. They have to prove it. And, it's coming around. I'm running into some of that myself. So giving people a heads up, finding out the process.
They expand on that, Jason, too. They have to prove that it's an unburdened cost why they cannot offer you a reasonable accommodation.
Agreed, but they're doing it anyway. And it's not as easy as everyone thinks, trust me, as we know. But it is running into, some challenges. So I just warn everybody, as much as I can, to try to put that stuff out there so people are aware of it.
Anything else, Jason?
Not at the moment.
Any other members? I am going to share my screen. There's a couple of things that have happened in the legislature, the thing that I wanted to share. So let me try and share this. Please let me know if you are seeing from affordability.
Yes.
Got it.
So, I wanted to just share this, after years of hard work, Massachusetts had finally made an important move to make prescription drugs more affordable and accessible. Last week, Governor Healy signed S 3012, which is an act relative to pharmaceutical access, costs, and transparency. A huge win for people struggling with high medication costs. This was sent from the Disability Policy Consortium. I should start out with. As a proud member of the coalition spearheaded by Healthcare for All that has championed this reform since 2019, Disability Policy Consortium celebrates this milestone, which holds transformative potential for people with disabilities across the Commonwealth. What does this law achieve? So they broke this down, so that's why I wanted to share it. The new law brings big changes to tackle high prescription costs and hold pharmaceutical industries accountable. The key provisions include capped copays for chronic conditions, people managing certain chronic conditions, diabetes, asthma, and the two most prevalent heart conditions will see their copays capped at $25, with generic versions of these medications available at no cost, reducing financial barriers to critical health care. Secondly, enhanced oversight and data collection. The Health Policy Commission, HPC, and the Center for Health Information Analysis, CHIA, will now conduct comprehensive assessments of pharmaceutical pricing trends and collect data on high-cost drugs. This will improve transparency and support evidence-based policymaking. Third, Pharmacy Benefits Manager, PBM regulation. The new law requires PBMs to be licensed and subject to greater oversight, curbing exploitative practices that have historically driven up drug prices. And finally, access to lowest cost options. Pharmacies must now ensure patients receive the lowest cost medications option available, easing out-of-pocket expenses consumers. Unfortunately, there's also another side to this, what was left out. While the law is a big step forward, it leaves out some measures that the coalition advocates for, such as HPC reviews of drug cost impact on access, or affordability improvement plans involving manufacturers. Additionally, certain devices like insulin pumps are excluded from the capped copay provision, leaving room for future enhancements. Why this matters for people with disabilities. For the disability community, affordable prescription medications are essential to survival and dignity. Many people with disabilities have chronic health conditions requiring costly ongoing treatments. For many, high out-of-pocket costs mean choosing between their health and essentials like food or rent, often leading to worse health and more trips to the ER. This law's provisions such as capping copays at $25 for chronic conditions, reduce financial barriers to essential medications, increased oversight and data collection, improve transparency, enabling policymakers to address price spikes and exploratory practices effectively. People with disabilities often find themselves caught between two competing forces: insurers and pharmaceutical companies. Insurers may seek to limit or exclude access to critical medications as cost control measures, while pharmaceutical companies set high prices for life-saving treatments. This dynamic creates a dangerous situation where essential medications and the people whose lives they save might deem not worth the cost. Law tackles a tough challenge of balancing affordability and availability, safeguarding those most at risk from both high prices and harmful cost-cutting measures. By ensuring pricing transparency and tighter oversight of PBM, it helps lower costs while keeping essential medications accessible for people with disabilities. And they go on to thank Governor Healy, Representative Barber, Senator Friedman, and all the lawmakers who got this bill to the finish line. So I just wanted to share that with the members because I thought it was quite important to let the members know and to our constituents in Revere. So although it did not get everything done, it is a great move forward. So just wanted to share that with you, and if you have any comments on that, I'm willing to listen. And
When does that law take effect? Does it say?
It's unfortunate. It just says it was signed. It doesn't give a date, but usually usually, I believe, get enacted pretty quickly.
I hope CVS and all the others seem to learn that, because I'll tell you right now, I just dropped, $75. In some cases, $30. I mean, I take insulin now, so
I believe
and
sometimes there's usually like a waiting period.
Yeah.
To comment, but it doesn't state anything in there on this, so I don't want to answer either way if it's enacted right away or whatnot. But like I said, you probably can look up the bill S.012, and there might be more information on it there.
the other thing I forgot to mention on the other thing, it just came up. We just did a review for Mass Health this year, for that PCA program. And one other thing that it's not realistic, but this is what they really want the program to be. And Ellie will probably find this pretty sick. So for me, I have to, because my wife works and other things happen, I have to put the 40 hours where I need it. Well, they say, well, if you're not going to the bathroom at this moment, then the aid isn't working. And they want you to spread it out throughout 7 days. That's not realistic. Nobody's going to work for 4 hours a day or whatever it may be. You know what I mean? And so you're just going to find some other challenges. I wanted to bring that up since Ellie and I have talked about the PCA program before. It seems to be getting more and more complicated. So just a warning to anybody who signs up for it.
Any other comments? I just have a couple of more late items that I wanted to mention. I received an email from the rec center today. I told them, Anne Marie, that we are working on getting a proposal to them for music therapy program, because they contacted me about the art program that I mentioned that they're going to be trying to initiate. They wanted to make sure that we were still on board to partner with them, and I told them we are on board to partner with them. They're looking for an instructor, and they're going to get me more specifics, because the Commission on Disabilities is going to help support and finance that program as well. So I just wanted to let everyone know, because that email just came today. The last thing that I wanted to mention, I'm not sure if anyone was able to watch last night's council meeting. But if you were, or if you haven't, please go to the Revere TV YouTube channel and take a look at it, and you'll see a shiny new ADA compliant podium for anyone to go that wants to speak or ask questions, comments at a council meeting or any subcommittee meeting, or anything that's going on that the public can address in the council chambers. It is unbelievable that we help pay for that through the funds that we receive with the Commission on Disabilities. It is fully ADA compliant. It's wheelchair accessible. The wheelchairs can slide right underneath it. It is electronic, so the height goes up and down, so it adjusts to the height. It is the Cadillac of podiums. So please check it out. And so we're trying to do our part in helping make things more accessible through the community and programs. So I just wanted to let everyone know that's what we're doing there. And lastly, I totally forgot about this, that I have submitted the grant application to Save the Harbor for their grant application for this year. That was the grant that I applied for last year for the All Abilities Day Out at Revere Beach, that I am applying again for this year. So I submitted that, and we'll see if we are lucky enough to be awarded that, so that we can have that event again down the beach. If we do not receive that grant, we'll try and find other ways to put that off and make it bigger and better this year.
Sounds
And-
good.
and, that there is pending, but I don't, that there's issues. I'm not sure if you have any questions. But if you guys could, raise your hand. Raising your hand. So there are no residents concerned about issues. And then number 8 is,
What?
is our next, step.
Ralph, I've lost your
Yeah,
audio.
can't hear you.
Did you lose me?
I lost you.
We can't hear you.
Hear me?
Sounds like it's muffled.
Yeah,
Can you hear me now?
a little bit better, yeah. But no, I lost you totally.
But you can hear me now, okay?
A lot better, yes.
I think that's because my phone rang. Um, so the beginning says, there's no residents concerned, so we're gonna move up to, item 8, next steps. So our next steps is that we, basically.
You're going distorted, Ralph.
Yeah, again.
You're dying out.
Pauline, do you want to take item 8 on?
Sure. So our next steps going forth is we will await some more information from Anne Marie on the music therapy program that's going to be coming live to Revere for your pleasure and participation. So we'll wait on that. I will get together the final little piece of our letter to Representative Turco for your perusal and see if anyone else has any comments or any other language changes that would otherwise support us. Additionally, we will continue to monitor the programs, the art therapy program that the rec center is going to be starting up, and hopefully we'll be able to support them as well. Going forth, I will continue to pine away at some folks or some people to see if anyone would like to join us on a monthly basis or on an occasional basis to give us updates on whether it's adaptive equipment, whether it's new adventures that are out there, new possibilities, updates from possibly our friends at the Federation. So I will work tirelessly to find us some folks. Other than that, if anyone has any additional comments, questions, thoughts, that will conclude our meeting for tonight. So we will await all of those things. And item number 9, our reminder, the Commission on Disabilities office number is 781-286-8267. Residents can also call Revere 311 directly and speak to the staff Monday through Friday. They will answer most of your questions, but if they are unable to, or you wish to speak to someone in our department directly, please ask to be transferred to the Disabilities Commission's office. Please leave a detailed message and someone will get back to you soon. As always, please don't hesitate to contact us if you have something that you would like discussed or added to our monthly meeting agenda or a concern. You can also let us know if you would like to speak on any issues or concerns. The Commission is here to help you and assist all the disabled residents and families of Revere. With that, if I could have a motion to adjourn.
Motion to adjourn.
Okay, and a second, please.
A second.
Okay, thank you both very much. That will conclude our meeting for tonight. Our next meeting via Zoom will be on Tuesday, February 11th, 2025 at 6 p.m. Wishing you all a toasty, roasty evening because I'm sitting here freezing in my office.
Oh,
I don't know why. I'll have to go search for an open window. And hoping that everybody stays well and healthy and just keep hyper vigilant on the hand washing. And if you can stay away from the crowds, please do.
Take care, everyone. Bye.
Thank you.
well, everybody.